PPE is part of the equipment that you wear to prevent cross-infection. Okay, the universal precaution is a standardized precautionary standard used globally. All right. One of the examples we had used was COVID-19. Everybody had to have the same rules. Isolation, right? There was a certain stand of distance you had to have with the person in front of you. Okay. That was a standard precautionary that the whole world took a stand on. No vaccination, no job. That was made mandatory in the countries, right? In the countries that refused to take the vaccination, right? And I think it was mostly some countries were okay. It was up to you if you want to get vaccinated. Fiji, they made it mandatory that you had to have the vaccination. Now, one of the reasons why Fiji was very strong, I personally think why Fiji wanted everybody to have the vaccinations, because due to the lack of our resources of having medical attention, right? And we wouldn't be able to survive a global pandemic that big. So that's why they were very adamant on everybody taking the vaccine shots to actually control the numbers of the people who could get infected versus the ones who had just a weakened immune system. So it could be our resources to be able to tend for them wouldn't be overused, right? Because besides COVID-19, there are other people who have long-term illnesses, cancer patients that we have, kidney failures, right? And we also have pregnant women also needing medical assistance. So the more people who could protect themselves from a global pandemic such as COVID-19, the easier it is for the health sector to be able to focus on the various other underlying issues of the health sector that is present, that's already been there. So they are not like understaffed and there was not much pressure. So personally, that's why I think that they made that rule mandatory. No jab, no job. So everybody could protect themselves and lift off the burden from the healthcare system. All right, guys. So as you can see on your screen, we talked about this last week. And just to recap, this is what you guys discussed in your group presentations, okay? Universal precautions are a standard set of guidelines to prevent the transmission of blood-borne pathogens from exposure to blood and other potentially infectious materials. Okay, it helps you. It's just a safeguard, right? It protects you. Okay, it's a standard procedure. Universal precaution. Universal means global. Everywhere in the world, they have this already set out. Okay, the purpose of practicing universal precautions is twofold. Universal precautions protect patients from further harm or infection, and also while simultaneously protecting the medical or first aid practitioner. All right, from contracting a blood-borne illness from an infected individual. So it's a twofold. That's what you called a twofold. Precautionary is twofold because it affects two people at once. Or the other saying that you could say it, two birds, one stone, right? It protects the client or the infected person from getting further more seriously or other conditions of other diseases, and also protects the first aider, the person, the first frontliner who is present there, be able to deal with these diseases up front. Excuse my voice as well. So yeah, if I'm a bit slow today, please. So moving on, what is just body fluids, right? Okay. Human body semen, cerebrospinal synovial fluid, pericardial fluid, peritoneal, amniotic fluid, in dental, any fluid that is visibly contaminated, all blood fluids and situated different body fluid. This is all bodily infection you put on personal equipment coming in contact with bodily fluid. Those are really some spectacular. Okay, basically talk about just bodily fluids. We're just talking about how what your body creates different kinds of, and because you carry bodily fluids also of transmission that can disease. Okay, so and vaginal secretions, right? So these fluids are produced by the male and female reproductive systems respectively and are involved in sexual activity, right? Now, these fluids can be contaminated with infectious agents such as HIV, okay, human immune deficiency virus, okay, and hepatitis, right? B or C, which can be transmitted during sexual contact as well. So when I talked about semen and vaginal secretions, I'm talking about the kind of infection that is present during sexual activity is HIV or hepatitis, right? So now we're moving on to cerebrospinal fluid, all right? Okay, a short form for cerebrospinal fluid is CSF, okay? Okay. Whoever's mic is on, can you please, Isnet, please mute yourself. Okay. Okay, Isne, please mute yourself. Okay, thanks. Okay. Cerebrospinal fluid. Okay, Isne, your mic is still not yet muted, please. Okay. Set. So, CSF, right? Okay. CF is a clear fluid that surrounds and cushions the brain, right? And spinal cord, providing protection and removing waste. So cerebrospinal fluid, okay, it's a clear fluid that surrounds and cushions the brain and spinal cord, right? While it's providing protection, it is also removing waste. Now, this fluid can become contaminated with infectious agents as well, particularly during medical procedures, like lumbar punctures, in cases of meningitis, okay? When you get meningitis, basically it affects the cerebrospinal fluid, the protective membrane that is around the spinal cord, that is around the brain, all right, that is protecting it from any form of harm or diseases. So these diseases, once they affect that fluid, your spinal cord is at risk, right? It could get infected. All right, guys? So vaginal semen and secretions, it gets infected through sexual activity. Cerebral spinal fluid, it becomes affected through the meningitis. Okay. Oh my gosh. Now, what is meningitis? Now, meningitis is a inflammation, right? Is an inflammation of the protective membranes. Okay, it's called meninges. Okay, so meningitis is when it gets affected. Okay, it covers the brain and spinal cord. Okay, there are various causes why someone can get meningitis. We talked about last week, we talked about how there's bacterial, there's fungi, there's a virus, and there's parasitical. Also, you can contract meningitis by either these four of these bacteria as well. Okay, and then if any of these four gets in contact with the cerebrospinal fluid, you are liable to contracting meningitis, right? Okay, one of the less common causes for meningitis is fungal, right? But the usual one is the viral meningitis. Like I talked about, viral is a disease, or sorry, virus. Virus is a disease. Okay, so there's bacteria, fungi, parasite, and the virus. So that is on cerebrospinal fluid. Now moving on to the synovial fluid. Okay, synovial fluid is found within the cavities of the synovial joints, such as the knees and elbows, where it reduces its friction between the cartilage of joints during the movements. Okay, we talked about this. Synovial fluid also could be related to arthritis, but it's like a secondary function, not really directly, but this is sort of kind of similar cases, but different. Okay, so the fluid can become contaminated through injuries, surgeries, or infections such as septic arthritis as well. Okay, so when contaminated, the synovial fluid can harbor bacteria or other pathogens, leading to joint infections. Okay, we talked about the peritoneal fluid. Okay, now this is something that peritoneal fluid, it's located around the abdominal cavity, okay, lubricating the surfaces of abdominal organs as well. So these fluids go together, and also the fluid that protects the lungs, okay, which is called it's pleural fluid. Okay, it surrounds the lungs, allowing them to move smoothly within the chest cavity. Okay, we talked about this. Okay, and also about when we talked about the changes of the heart, we also talked about the slippery surface where it has to be lubricated for it to be able to beat through the surfaces. Also, that is also a fluid called the pericardial, okay? Pericardial fluid, okay, that helps in reducing the friction during heartbeats. So the peritoneal fluid, it's located in the abdomen cavity. It lubricates it from reducing friction, okay, of the abdominal organs as well. Now, that can get contaminated as well through infections, medical procedures, okay, or trauma. Okay, contaminated fluids all harbor bacteria, right? So we're moving on to saliva in dental procedures. Okay, saliva is produced by salivary glands in the mouth, and it aids in digestion and oral hygiene. We talked about this when we talked about the digestive system. Okay, saliva is produced. Okay, during the dental procedures, saliva may become contaminated with blood or other infectious agents. Okay, that can occur through cuts in the mouth, okay, dental instruments, or bleeding gums, potentially leading to transmissions of infections such as hepatitis as well. Okay, any fluid visible with contaminated blood as well. To summarize what we all talked about, these are different forms of fluids, okay, in the body, and they all can get contaminated for various reasons. But for your precautionally, while practicing the universal precautions that can safeguard you from getting these diseases, whatever fluid, bodily fluid that might be dispersed, okay, they might have meningitis, they might have HIV. That is why it's so important for you to have proper PPE or be aware of the universal precautions, okay, that surrounds yourself, that safeguards you. All right. So now when we're moving on, standard precautions. Standard, okay. Okay. Standard precautions apply to the care of all patients. Irrespective of their disease state, these precautions apply when there is a risk of potential to exposure to blood. All bodily fluids, secretions, and excretions except sweat, regardless of whether or not they contain visible blood, non-in-contact skin, and mucous membrane. All right, so standard precautions are a set of infection control practices used in the healthcare settings, all right, to prevent the transmission of diseases. These precautions are designed to protect both healthcare workers, like we have discussed, twofold, and patients by minimizing the risk of exposure to potentially infectious material. Importantly, standard precautions are applied universally, meaning they are used for the care of all patients regardless of their known or suspected infection. So whether you think, whether you know, or whether you've come to a conclusion of the disease your client or someone you suspect might have, okay, standard precaution is mandatory regardless of the situation. Okay, key components of the standard procedure, like blood. Okay, the risk of exposure of blood. Blood is a common carrier of infectious agents, including viruses such as HIV, we talked about. Okay, all bodily fluids, okay, such as urine, feces, right? Urine, feces, mucus, breast milk can potentially carry infectious agents. Even if these fluids do not visibly contain blood, they can still be infectious. The protective measures that you take, okay, while protecting yourself is wearing proper gloves, okay, the proper PPE equipment. All right, guys? Thank you, Ravina. Yeah. Okay. Non-intact skin. Okay, number 3. Okay. Risk of exposure. Okay. Non-intact skin refers to the skin that is broken, such as through cuts, abrasions, rashes, right? Or other injuries. Broken skin can serve as an entry point for infectious agents we talked about. Okay, mucous membrane. Okay, mucous membrane are the most surface lining of the nose, okay, the mouth and the eyes and other body cavities as well. These membranes are susceptible to infection because they can easily absorb infectious agents. And the infectious agents, like we talked about, it is either through bacteria, virus, which is trying to get in, bacteria, virus, or parasite. Okay, guys? Or fungal infection. Okay. Okay. So this includes hand hygiene, personal protective equipment. Okay, this includes hand hygiene and personal protective equipment, with hand hygiene being the single most important means to prevent transmission of disease. Personal protective equipment serves as a barrier to protect the skin, mucous membrane, airway, and clothing. It includes gowns, gloves, masks, face shields, or goggles as well. So the reason for you to be able, why you wear goggles, right, is because of the mucous membrane. Okay, your eyes also are susceptible to absorbing infectious agents. That is why it's mandatory for you to wear goggles. Okay, that is why you wear gloves, because infectious diseases can also travel through the pores as well, depending on the microorganisms that you are exposed to. And yeah. Okay, hand hygiene, we have talked about this, washing of your hands. Okay, the standard procedure that the WHO has put out already. We talked about this in our last class about the types of PPE in healthcare settings. Okay, know the 5 moments for hand hygiene. When do you wash your hands? Okay, before touching a person, you wash your hands, sanitize, right? Before any procedure, whether you're taking their temperature, whether you're taking their vitals, wash your hands. Immediately after any procedure, after you have done the procedure, wash your hands. Okay. After touching a person, you wash your hands. Okay. After touching a person's surroundings, like we talked about the cleaning utensils, we talked about coming into an infected person's room space where they were disinfecting it, washing your hands. Okay. Sure, you probably disinfected the whole room, but what about you? Wash hands, change your clothes, wash your clothes. Okay, so that is basically last of our slide. Yes, our class today was really fast. I'm gonna put you guys in groups and we'll just have a short discussion, okay? Priyanka is just laughing. And tomorrow we will be starting on our new topic, Unit 5. This week we're going to hit Unit 5 and Unit 6 as well. Okay. Unit 5 has to do with independence living, assisting in ADL's activity of daily living, which we will learn about that tomorrow. I'll be sending the notes through emails. And also, polypharmacy is Unit 6. Polypharmacy consists of 2 units, which is polypharmacy is basically about medication, and routes of medication is the second unit in Unit 6 as well. So that is something that you could look forward to for this week as well. God. So I'll just put you guys in 3 groups. So, yeah, you guys will be evenly distributed, 5, 5, 5. I just put the question into the chat group. Just move that there. Okay. Okay, if you look into your chat groups, I have posted up your questions. Group 1, it's Andi, Alisi, Afsa, Amit, Maureen, and Shelley. All right. Group 2, it's Ashwita, Kahira, Nirma, Ravina, and Sangita. Okay. Group 3, Laikini, Priyanka, and Ruby. 2. Ruby, Sainimili, and Shalesni, that is group 3. Okay, group 1, your question. In the Pacific Island healthcare settings, why is hand hygiene emphasized as a critical practice? As a critical practice for preventing the spread of infectious disease, particularly in rural and remote areas. So focusing on hand hygiene on both of these locations, rural and remote areas. Why is it emphasized? Why is it important? Group 2, how can the use of personal protective equipment, PPE, such as gloves, gowns, masks, be adapted to resource-limited healthcare settings in the Pacific countries? To ensure the safety of the healthcare workers' patients, we talked about this briefly when we had mentioned COVID-19 and the mandatory steps that they had taken just to take off the pressure of the healthcare setting. Thus, they introduced no jab, no job. All right. So just circulate on that idea, and what do you think, okay, could be the answer for that? Okay, how can the use of personal protective equipment, okay, and must be adapted to the resource-limited healthcare settings in the Pacific? Okay, what challenges might healthcare workers in the Pacific countries face, group 3, when implementing standard precautions, and how can these changes be addressed to improve infection control? Okay, the challenges that healthcare workers face within the Pacific. Ravina had talked about this in her last discussion, where she talked about the challenges that they had endured, right? While trying to provide for the, while they're trying to provide care, right? Care for the whole of Fiji. Okay, so now you can think about the challenges of a health worker, put yourself in that position from a frontliner's point of view. And how do you think these challenges can be addressed to improve infection control? All right, guys. So if there's any questions, then you can call me and I can deliberate more into your rooms. So I'll be giving you around 15 to 20 minutes. All right, guys?
Forms, it can come in simply the washing with soap and water, or using alcohol-based hand sanitizers, or even having antiseptic hand rubs. That is what hand hygiene basically is. Now, with respect to our discussion topic on its emphasis on rural and remote areas, why hand hygiene is emphasized as the most critical or the most valuable practices. These settings, they have limited access to healthcare services. They do not have enough resources or healthcare materials. It's very scarce. So hand hygiene is emphasized because it is simply the most easiest, it's less expensive, and it's the most effective way to control or prevent the spread of infection or diseases. Yeah? Another factor that we also came up with is cultural factors. In rural and remote settings, a most common habit, I'd say, the most common habit is having shared facilities. Shared facilities in the sense of having a common washroom. Now, having that image, we can only come to one assumption, that it will spread the diseases very, very quickly. So having that image, or having that type of lifestyle present in our rural and remote settings, and when hand hygiene is made aware to the communities, it will help in the prevention of the spread of the, due to the fact that shared facilities, having 1, 2, 3 houses and just having one common washroom, due to their lack of resources, lack of poor living standards. The only way we can try to combat the effect of spreading of diseases is making awareness to the community, having those shared facilities, that hand washing is just the best option to prevent any diseases that they may come across with. A factor that our group also come up with was the having limited resources, such as clean water and medical supplies that may also be scarce. Though rural and remote settings, they don't have treated water, but they have some form of supply of water. And if awareness is made more frequently to the communities, to the villages, that this is the only effective way, due to them having less of resources, due to them having a lack of healthcare facilities or lack of healthcare workers present in their nearby health centers, the only way in which they can try to reduce the spread of infection is through hand hygiene. The importance of hand hygiene needs to be made very clear to our community members, especially those living in the rural and the remote settings. One importance of hand hygiene is that basically it prevents disease transmission. It is the most effective way that we can prevent the spread of infectious diseases. Another importance that we also were able to sum up was, due to the living conditions and limited healthcare resources, having hand hygiene practices, it reduces the likelihood of disease outbreaks within the community. And it can also conserve medical resources, that whatever medical resources that they have at the moment, that they are currently trying to survive with, having simple actions such as hand washing or hand hygiene being known to the communities help in the long medical resources. They might have limited supply of antibiotics. They might have limited supply of medications, pills, the common medications that are normally used to treat infections or diseases that are quickly spread within the community. Another important factor that we also came up was the safety of the healthcare workers themselves. Rural areas, healthcare workers are very limited. Like, for example, I'm here in the upper area of Waindina in Itasiri, and our health center from Nangali to where I am actually in, we only have one health center. One situated in Nangali, where there's just a doctor and 2 nurses. After maybe 2 hours drive, then you come to the nearest health center. And their nearest health center has only one nurse at the moment with one doctor. Sometimes the doctor is on and off, and there's just a nurse that's handling the whole Waindina area. So the healthcare workers themselves are limited. After leaving the Nambuka Luka station where I'm nearest to, there will be another 3 hours drive, close to 3 hours drive to where you will get to meet or you'll get to visit another health center. That's right in the upper of Namusi. So along the way, if there is an emergency just in between the 3 situated health centers, we won't be able to cater for whatever that happens in between the 3, in between the villages. So if the communities are made aware that the only way to spread certain diseases or certain infections is through hand hygiene, then awareness needs to be brought closer to the communities due to the limited of having healthcare workers being posted to their nearby communities. And to sum up, hand hygiene is the most effective way of treating or preventing preventing the spread of diseases in our rural and remote areas. It is less expensive, and it is the easiest. That's all, madam, from Group 1.
Okay, thank you so much for that, Andy, Alisi, and Group 1, for your discussion on basically the question: in many Pacific Islands healthcare settings, why is hand hygiene emphasized as a critical practice for preventing the spread of infectious disease, particularly in rural and remote areas? It was explained wonderfully by the group, how they had talked about the distance of the healthcare settings, right? 3 hours away, 2 hours away, and with the lack of faculty staff as well, with 2 nurses, 1 doctor, and sometimes just 1 nurse and an on and off doctor. And due to the limited resources to cater for such a large number of people, due to the the scarcity of the faculty of the healthcare system to be able to tend for a large number of people that's present in the area. Okay, one of the main reasons why people need to be educated on hand hygiene, because that is, like she had said, one of the most effective ways, and it's cheaper as well. It doesn't cost money to wash your hands. Okay, even though the water is untreated, all right, they still have a form of water coming in so they can be able to practice hand hygiene, right? It's just basically how bacteria, contagious pathogens are passed due to the hand hygiene, how they're keeping themselves, right? And if they're able to be taught that, if they're able to proceed with these steps carefully, they get to save a lot of time, effort, and less stress on the healthcare setting as well. Thank you so much for that, Group 1 and Group 2, for their insight and how they personalize that question based on Naitasiri, where Andy Alisi lives. Thank you so much for that, Andy Alisi. Thanks so much, Group 1. And thank you so much, Amit, for your answer, also in the group chat. Now, moving on to Group 2, Ashwita, Avnita, Nimra, Ravina, and Sangeeta. All right, guys. How can the use of personal protective equipment, PPE, such as gloves, gowns, masks, be adapted to resource-limited healthcare settings in Pacific countries to ensure the safety of healthcare workers and parents and patients? Sorry. So yeah, is group 2 ready?
Yes, madam.
All right. Okay, Sangeeta, take
So
it.
our question to group 2 was like, how can the use of personal protective equipment, PPE, such as gloves, gowns, and masks be adapted to resources limited healthcare setting in Pacific countries to ensure the safety of healthcare workers and patients? Here are some of the strategies to consider. First is train healthcare workers by providing training on proper PPE use, including donning, doffing, and disposal to minimize contamination. Emphasize hygiene and the correct use of available PPE to maximize the protection even with the limited resources. Secondly, I would say the community engagement. Educate the community on the importance of PPE for healthcare workers and patients. This can increase community support and cooperation. And I think my group will continue from here.
Yes, ma'am. This is Ravina here. So from group 2, I have also some of the things that I would like to share, like to lead by an example for what we can do in our community and our workplace, and to provide the training for the employees. Example like hazard and solutions, what can be done if in case of any outbreaks or things like that, and doing awareness in community and assess the result of setting and selecting the PPE. Consider the comfort in the ethical issues and maintain the equipment if it's out in the community and even though to our workplace, how to maintain the equipments for our mask, gloves, and things like that to control the exposure of disposal. Like we have seen, if we are giving gloves for the children to collect rubbish or things like that, after that they will try to use it as a balloon. So the proper disposal is important also after giving the gloves and things like that. For our generation, as simple as equipment is inside our house. Like everyone doesn't have equipment everywhere, so the apron in the kitchen is very helpful. And always teach children how to use simple things, example like handkerchiefs and hand towels inside their own houses. And for simple things to protect against the basic elements, it could protect any type of risk and frontliners or healthcare workers in any age care. So it always comes under HR department if we are working, that how do we get that safety first. So it comes always under HR department to see our safety in health and infection basic wise, to look for employees to always to keep a record, like if any employees got hurt beside using those equipments, so we have to have a solution for that. So it also includes our safety for the visitors too, like when we are doing our uh, patients, when we have visitors, so we have to look at their health service and the safety for them too. So that's why we have to sometimes give them the gloves and masks to wear and visit the patient. And that's why some of the wards they don't allow children, because children sometimes suffocate while wearing masks and things like that. So the safety of everyone is included in healthcare setting and the patient while visiting them. So everything is in a one whole feast type of, I could say. It starts from your hand, how hygienic you are. So always make sure that 5 fingers is also makes a fist. And a fist, if it's a strong fist, so you can always keep your family, and wherever or whatever frontline job you have, you'll be always safe and cleaner. And I think other team are also want to include from group 2. Thank you from my presentation, ma'am.
Ravina and Sangeeta. Group 2 is before. Does anyone else want to speak on that group 2, or that's okay? Okay, So Ravina and Sankita had a really good discussion. Group 2 had come up with really interesting points, and something that had caught my attention was how they had talked about the importance of PPE, how Sankita talked about the importance of PPE, and Ravina had given examples that pertained to cultural effects in the Pacific. She had talked about how the balloons, how children were given gloves, and then after they used it as balloons, right? And to prevent cross-infection, because that's not safe, but proper PE, then they use it while disposing of infection. Or people use it again as a form of balloon, and that can spread again the infection that everybody's trying to contain and control, right? So that actually defeats the purpose of the PPE. Improper disposal defeats the purpose of PPE. And also, she talked about using a handkerchief, right? Due to the limited resources that the Pacific Islanders are accustomed to. Like the question is basically asking, so due to the limited resources, how can this be adapted into the Pacific Island settings? Like she talked about, in the primary school setting, everybody should get a handkerchief, right? It's mandatory. There is checks for children to always bring their handkerchief, and they are taught how to use this, covering their mouth, washing their hands, okay? People just think it's proper courtesy. No, it also is a form of controlling infection. Control, when they're coughing, it just stays within the handkerchief and they put it back in, okay? Wiping off their mouth, wiping off their saliva, wiping off their hands with the handkerchiefs that they are brought from home. That is due to the scarcity, the availability of PPE, because it is not a cultural thing that we have, right? So we make use of other resources, replacing it, okay, with handkerchiefs. All right. So thank you so much for that, group 2. Does anybody else want to contribute before we move on to group 3? Okay. So we're moving on to group 3, and their question is, what challenges might healthcare workers in the Pacific countries face when implementing standard precautions? And how can these challenges be addressed to improve infection control? Group 3 is Eli Kinney, Senimile, and Chalesny. Are you guys ready? Thank you again, group 2, for your discussion. All right, Chalesny. Okay. And Senimile and Eli Kinney. All right.
Hi,
So
team.
you guys.
Okay, hi, team. So, likewise, our question was challenges might healthcare workers in Pacific countries face when implementing standard precautions, and how can these challenges be addressed to improve infection control? So, our group came across with resource limitations. Like many Pacific countries may have access to essential supplies such as PPE, which includes disinfectants and sterilization equipment. This scarcity makes it difficult to follow standard precautions like hand hygiene, wearing gloves, or using masks. The solution we came across is if this can be addressed to governments and international organizations, then it can be worked together to improve the supply chain, ensuring the steady flow of necessary materials, and some of the items or innovative use of available resources which can mitigate shortages. And another one, ma'am, we came across, I don't know whether I'm right or wrong, it's a geographic isolation, where like Pacific islands, and which can make them difficult to distribute resources, provide training, or offer consistent healthcare services, and leading to inconsistencies in infection control practice. So the solution here we came across is to implement training programs can help the gap caused by isolation, and establishing regional hubs that can serve as centers for distribution, training, supervision, and can help standardize practices across dispersed locations. So that's all. It's from me. I think my group will continue. Group 3, please.
Yes, I will take over from here. Just in relation, one of the implementation for our standard precautions would be the challenges could be relaying information to the public. I don't know if it's right, but I think the major part is letting the information fly out to the people about infection and how it spread and how it can be controlled. And accessing this public on a big scale could be a very big challenge for a healthcare worker. So one of the solutions we could think of is a very simple, raising awareness or carrying out campaigns or, setting up healthcare tents, distributing pamphlets that has particularly information about, this. Important.
Adding on to that, madam, on the education. Hello?
Yes, Jenny, really take it away.
Yeah, adding on to that, on the lack of training and education, madam. Their languages, delivering their language so that they can.
Thank you so much for that, group 3.
Public awareness.
Thank you so much for that. Yes, that is so correct. This okay, like Kimmy, do you want to go next?
Good afternoon, ma'am. And is myself only having this problem, connection problem, or everyone? Ma'am, can you guys hear me?
Yeah, I think everybody is experiencing. Yeah, we can hear you, like Kimmy, but I think everybody is having a form of connection problem. Because now I'm checking my phone, it's flooding. Yeah, so it's okay.
Wait, so now is it you can hear me
But we can
properly?
hear you, like Kimmy.
Okay.
Yeah, we can.
So our questions in group 3 is about challenges and what are some of the issues that we can overcome these challenges. In Pacific Island, we have lived in extended family under one roof. In regards to this, people all live together under one roof. So we are familiar with the way that we brought up in our own society, in our village, rural areas, urban areas. Extended family, they not only living together under one roof in rural areas, also in urban areas. So we should practice this at home as well. Out of, I can say an example about we will destroy by the lack of knowledge. Everyone will destroy by a lack of knowledge. The challenges we face is that lack of knowledge from a new generation older generation, and so on. Out of the 100% students, out of the 100% people, kids born in Fiji, newborn kids in Fiji, only about, I'll break this down. From that 100%, only 80% of these children, they're going to primary school. So where the other 20% going to, they are not going to school. So they don't have any knowledge about this in regards to what we have discussed in regards of how to to overcome these challenges. So we have to put our hands together to help these 20% gain knowledge of how they can adapt this safety with their daily living. And out of this 100% going to primary school, only 60% they going to secondary school. There are another 20% drop out from primary school. So see, the lack of knowledge is keep on coming. And out of these 60% of students from secondary school, about around only 30% they're going for tertiary education. Only 80% they're going for tertiary education. And again, from tertiary education, only about 50% they are graduated. And the rest, they are not complete their studies. And they go back home and they practice the same way they have been brought up from the village, from their extended family, from their way of life, the normal way of life back in the village. So out of these 15% graduated students from tertiary education, from university, around only 5% of these students, they practice this at home, at work, and also at home. Why I say this, some doctors, once they enter the hospital, they are doctor, and once they go out of the hospital, who they are before. So they practice hygiene, they practice awareness in the hospital, they practice healthcare safety in the hospital. But when they go back to their family, they are the one who's supposed to become a role model, and they are not practice this at home again. So they are only doing, their career is only a way of money. It's just for money. It's just a sort of income. But they don't practice their knowledge, what they have catered from their career on their daily living and their way of life. They should practice at home. They should be a role model. It only takes one rotten potato to spoil the whole set of potatoes. So that means if you are a doctor, you can change your whole family. It doesn't mean that only bad person can make the group of person all bad. It take one good person to change the whole family to become good. Everyone can become cooperate. Everyone can, because he or she should be a role model to practice and show the health safety at home as well. So in Pacific Islanders, also something that we have faced is about extended living and a dropout in school and less safe practices at home from healthcare workers, because they are only called healthcare workers once they enter the healthcare facility, and they back to their KVT normal lifestyle once they get back home. And another thing, because in Pacific Island, we have Fijian medicine, we have organic medicine. Most people are focused on that. Okay, going back to that percentage of students that I just discussed with us earlier, from that 100%, only 5% they practice this from home, from work, and at home as well. So only 5% of healthcare workers, they are fighting for these challenges. They are fighting for this safety every day. And the rest of the 95% of students they drop out from school. These people, they are lack of knowledge. And when they drop out from school, they back to the Waivakabiti. They back to the old way that they are brought up from the village. So we in Fiji, in Pacific Island, if there's a sickness or any flu or fever, we will rely on Waivakaviti. We know what Fijian medicine will take. You don't worry if you drink that dirty water. If you get diarrhea, we have diarrhea medicine here. You just have to eat tangwawa leaves with some salt, and then your diarrhea finish. Or you have to do this or do that. You drink this, that root or that stem, you bring it together, you warm it, and then you soak it one whole night, and you drink it the next morning for 4 days. So that fever will gone. So particularly as Tauke, Pacific Islanders, we rely on our knowledge from our generation. We hardly adapt new challenges. We hardly adapt new knowledge from school. We hardly practice what we have learned at home and in our society. So these are some of the challenges. And the one way I can say that we can that can cure that can solve these challenges is by raising more awareness. And if you are a healthcare worker, please practice at home as well. If you're a doctor, try to be a doctor at home as well. Whatever you do in the hospital, you do it at home as well. Because as a healthcare worker, you are not only taking care of your patient in your healthcare facilities, you are also taking care of your family and people living around you in your community. Penaka.
Thank you so much for that, Ilaikini. Group 3, you guys have really answered that question really well. And your question was, what challenges might healthcare workers in the Pacific countries face when implementing standard precautions, and how can these challenges be addressed to improve infection control? Okay, so they had also talked about the education, right? To be able to educate people on a large scale as well is a bit, it's a bit hectic, okay? Considering the availability of the staff, considering the scale of people that they have to provide the education to, right? That is one of the challenges faced by the health workers. Another one that someone had brought up, I think it was Saini Milisha, talked about the Itauki language, okay, or the Hindi language that our brothers and sisters use, that portraying the message to the general public, not only in English, but into a local language that they understand, to be able to get the emphasis, the importance out there of how it's really important to implement these standard precautions into their community settings, and just how like Ilaikini wrapped things all up, and he talked about how the how Ilaikini had talked about wrapping everything up, basically about without the lack of knowledge we get destroyed. And he brought that idiom in where one rotten potato spoils the rest, but really we could use that for good and be like, we just need one person to change the trajectory of a family. And that is true. It's practice what you preach. You're a healthcare worker. You also come and you practice that at home, what you've learned. And I'm not sure if Ilaikini's statistics were a bit right, the 95% and the 20% and the other. I'm not sure if his statistics was on point, but Ilaikini has demonstrated.
I just come up with that. You don't have to take that for granted.
Thank you, Ilaikini, for that breakdown. I thought he had a graph going on all of a sudden, then going like 95%, 20%. But thank you so much for your creativity on how to relay the message out, which is actually true. Okay, which is actually true with a percentage people that we have that don't implement these ways. Because if it was true, we wouldn't be having as much a sick person that we do in the community. We wouldn't be needing as much as awarenesses. And it goes back to our culture, okay? Like he talked about, we live in a communal setting as well, all right? So we're so used to staying with each other and not having isolation, not being far apart, okay? And when we go out to school, that knowledge that we have is just for there. It's a career basis thing. When we come back home, we don't practice what we talk about, right? But if we implement it in our own families, in our own community, in our own societies, you can make a difference with whatever knowledge. Probably you're not in healthcare, probably you're a teacher, okay, probably your whatever background that you come in professionally. What can you implement in your own family, in your own community that will make a difference? Okay. Probably a word of encouragement to anyone that you meet, or the knowledge that you have about business. Okay. That can also pertain to another person's life who has no qualification or no background knowledge. Okay. Giving back to the community. Okay. What you have, it's probably not money, you probably can't afford groceries, you have enough for yourself, but what part of your knowledge, okay, can you share to other people that can enhance their quality living? Talking about, do not condemn people, please, that you're too dirty. This is how diseases spread. Please be kind with the information that you spread. Okay, don't be mean about it. Just go about it in a holistic, diplomatic kind of way where you address the issue, not the person. Okay, do not bring their personal issues when you're addressing the issue. Do not bring their personal life. You just, okay, this is what's happening, and I see this is the output. But if you put more effort on this certain of the area, I think it would change the whole trajectory of your life. But that's just some friendly advice on how I think this can change your whole future, depending on the situation, guys. So thank you so much for that well-diverse conversation that we talked about. And I want to thank each and every one of you for your deliberations, for your input. All right. And it's very important and it's very imperative. And I'm so proud of you guys being able to listen to the information and connect it to your own communities, connect it to your own societies, connect it to something that's personal. We had examples coming about, oh, because I live in this area, Naita Siri area, this. Okay. So Nivil talked about how having it in her Itauke language. All right. And then we had Eli Kimi with the statistics, and everybody else, Ravina as well, Sangeeta, with their own personal experiences, putting it out there. Shirley as well, Shalashni. All right, everybody that had their put in, and I missed out your name, so sorry, I meet as well. Okay. And for those of you who are struggling with the internet, we know that you are with us in spirit, Ruby as well, and Priyanka. Thank you so much for your participation as well, because I know if the internet was good, you guys would be probably bawling right now over the Zoom. But thank you so much. And yeah, so that is a wrap up for our Unit 4 on infection control. I still have not sent out the quiz, an update. I still have not sent out a quiz on the on module 2 quiz 3, which is the changes of the heart, right guys? That topic there, change the heart, reproductive system, and respiratory system. I have not sent that out. I will be sending it out this week, probably Tuesday or today. Reason being is that infection control and effective communication will be just one quiz. I'll put them together and we'll just have one quiz, probably 50 questions, 25 each, or multiple choice. So I'll be assessing you guys on that one quiz. So that's why, yeah. So we can have one separate quiz for the urinary system, no, the changes of the heart, reproductive system, and the respiratory system, all for one. And then towards the end of the week, then I'll be sending out your Unit 3 and Unit 4 quiz, which is effective communication and PPE as well. Questions as well for that. All right. So yes, any questions? Tomorrow we'll be studying on ADLs, which is activities of daily living and fostering independence. I'll be sending out the notes after this as well. And yeah, the notes for that. And also I'll be putting in the Viber group in case you don't have access to that. Yes, Priyanka. So, right. So by this week, and also Unit 6, we will try and hit Unit 6 as well this week, which is basically about polypharmacy. Polypharmacy is about medication, okay, which you'll come to learn about and read about as we proceed with our classes. And there's just 2 units in Unit 6, which is basically forms of medication, polypharmacy, and routes of medication, different kinds of routes that is taken in order to administrate medication. I think the ones that is most common in Fiji is tablets and injections. In this topic, we'll be going a bit deeper, looking at the spectrum from a global point of view, because let's face it, caregiving is a more need overseas. It's a need everywhere, but it pays better there. So if you're going to go into a more global setting, this is just basically a knowledge to help you set the platform to what to expect. Okay, depending on the healthcare settings, you might not be the one administrating medication. There's probably a nurse assigned to that, an RA, okay, an RN, sorry. But depending on the situation, it's good to be well versed with what's happening with your client, with what does the health system consist of. And with that note, always understand that due to the fast pace of technology, due to how information is being carried, there's always an update. All right, there's always a newer version, there's always proper information, there's always a updated version of anything that we discuss about, because technology is moving at a fast rate. So that's why it's very important when you get information, right? How updated it is, okay? How relevant it is to the society that we live in now, okay? As time advances, so does our society advances. So how can you say that PPE precautions of this certain area in 2015 is the same as 2020, 2024? It's actually not, because it has changed over time due to the advancement of technology, due to the more complications of the disease that we're coming to encounter. 1996 is not prepared for the 2019 COVID-19, the COVID that hit us in 2019, obviously because resources was different, information system was different. So if you brought in the 1997 mindset, lifestyle, and they encountered COVID-19, how do you think that would look like? Be a debacle, it'd be a hassle, okay? So think about it. The advancement of technology, information system, be well informed with what you're talking about, how relevant it is to the society that I live in, okay? The updated information, and what is relevant to my Pacific Island, to the community that I live in. How can I merge these two? Is there other alternatives, okay? So being informed is just a benefit for you and your family. Like Imi had talked about, it just takes one person to change the trajectory of everybody's life. Okay, so without further more ado, if you guys don't have any more questions, I will be seeing you tomorrow, 5:15 p.m. If you're late, okay, if you notice, if I have only less than 10 students, we start at 5:20. Okay, that is your grace period. You have 15 minutes of grace already. And then now it's extended another 5 minutes for you guys. So if we're having less than 10 students online, I will be waiting for at least we have 10. As soon as we hit the 10 mark, we'll be starting classes. All right, guys, it doesn't only have to start at 5:15. And I understand you have work, there's internet connections. So that's well and aware. But 5:20 is our cutoff time to be able to start classes. All right. So anybody has questions?
No, ma'am.
Okay, thank you so much, Amy Millie. I hope you guys have a wonderful, blessed evening. Thank you so much for your contributions. Ilaikimi, Seleshni, Sangeeta, Maureen, Amit, Shirley, Ashwita, Ravina, Afsa, and Andy. Nirma, Ruby, Avi, thank you so much for joining. I see you guys again tomorrow. Nis.